prediction of navigational positions. Now, the case that you mentioned, now minor adjustments in surgery, they are kind of second nature to surgeons. Surgeons grow up with that. They need to make minor adjustments during surgery, and these are almost semi-conscious decisions. Surgeon is not even fully conscious that he made that decision, because these things go on. When we are explicitly trying to program them in an AI model, I mean, should I say that we're trying to program common sense into them?
Not really. See, basically, this is something which will not be used routinely. It will be used in areas where we are close to critical structures, like carotid artery, like the optic nerve. So the issue is, if we completely rely only on the navigation in these scenarios, we may inadvertently damage those structures. So with this AI input, where AI is accounting for the removal of tumor and subsequent change in the location of those critical structures because of the removal of those tumors, it can really help us to be safer. Also, in many scenarios, it can be really help us to be complete in our surgery. We will not leave any tumor behind, because we are now very sure to the 1 or 2 millimeters that this particular structure is away from me.
So, we come to the other side of the coin, that is imaging. Now, image recognition has been traditionally held to be a forte of humans, whereas AI models, even a few years ago, AI models had difficulty with this kind of scenario. So, because there is something in humans that is still lacking in AI models. So, coming to the Professor in HOD radiology, Colonel Sahadev sir, where all does AI help the radiologist in the case of head neck radiology, sir?
See, in case of head and neck regions, there are two things. First is there is motion because of swallowing and breathing. So there are artifacts because of that. And second thing is there are tissues of different densities which are placed very close together, like air in the maxillary antrum and the bone which is adjacent to it. So all these things, what they do is to degrade the images when we do CT scan or even in MRI. And third thing is, of course, the dental implants. Of course, they have got their own artifacts. So we do have algorithms, AI-based algorithms, which actually improve the resolution of images, even though there might be dental implants. And second thing, what they do is to increase the speed of acquisition, especially in case of MRI. So when you improve the speed of acquisition of images, so all the artifacts which are happening because of the motion, they get reduced. Now, apart from that, there is also AI-based algorithms which do synthetic imaging. Synthetic imaging means, like suppose for a particular disease entity, you are doing 5 protocols in MRI. But using that AI-based algorithm, you can skip that particular sequence. Like you can make a diffusion weighted imaging sequence from a T2 weighted sequence. So you're again reducing the amount of time which you are giving to one patient. So this synthetic imaging can be used within the modality, or it can be seen between the modalities. Like if you have done a MRI of a temporal bone, but for your surgical planning, you want a CT of temporal bone. The same MRI of temporal bone can be used to make those CT images of the temporal bone without exposing the patient to a radiation. So this is synthetic imaging, which is helpful. And the third thing is the segmentation and the lesion detection and the lesion segmentation, which is very helpful in radiotherapy. This is the third thing which can be done using AI-based algorithm. And the fourth thing is, of course, the radiomics, which has come in, because there are certain things which cannot be seen by a naked eye. There are certain lesion feature extraction which can be used, can be done using AI-based algorithm. And using this feature extraction and further analysis, the AI-based algorithms can differentiate between a benign lesion and a malignant lesion, and even prognosticate a disease. So these are few of the areas where AI will make a difference, especially in head and neck radiology.
Sir, if I may slightly deliberate on that, Rahim sir, I'll request you to clarify what do you mean by feature extraction, and what all things are not visible in an imaging, sir?
See, when we call about feature extraction, that means suppose I have given an example. There is a tumor in the, say, nasopharynx. So traditionally, what happens is like if you ask a surgeon, he says by looking at the texture of it, or you can look at the firmness of it, the color of it, you're able to predict what kind of tumor is it. So that is, and in imaging wise, the traditional imaging is basically it tells you, we say the HU value we calculate, and this we see at the size and the things. Based on that, we say this is a probably benign lesion or a malignant lesion. So when we identify these features and this, and we extract these features, we teach the model, suppose a texture or the heterogeneity inside the tumor or the vascularity inside the tumor. Nowadays, people are thinking about the tortuosity of the vessels in a neovascularization. Based on that, they are trying to predict whether this tumor would respond to a certain treatment. That is the level of feature extraction we are thinking of. That is one way. Second way is, like I said, there is another way of doing AI without using feature extraction. That is end-to-end learning. That means we just give the input and you ask the output. So that is without feature extraction.
Just to emphasize this point further, if carrying on with the same example, the 6 panelists here, if one of the features is our shoes, that would be counted as a feature, I guess. But not all features are equally useful. So model has to be trained because depending on uniform, most shoes are alike in a certain service. So this is not a very useful feature to be extracted. But the face, obviously, the presence of glasses, eye color, these are individualistic features which are useful to extract. So how does a model know which ones to look for and which features are unnecessary, sir?
Okay. In a strict ML parlance, if you look at decision tree classifiers, DTCs, what they do is they look at the what we call as a cross entropy. So that means, in a simple words, what is the weightage to be given to that feature in a given data set. So based on that, it kind of identifies what we use it called as information gain theory. So that means the system, you can say, extracts a number, or you can say which is the most useful feature which will make me do a classification problem, or identify which will help me to discriminate between a data set. Suppose I want to say between Army, Air Force, and Navy. If I have to differentiate these 100 people into 3 groups, so which is the most useful feature which will give you maximum information gain? So using information gain, we can use decision tree classifiers or random forests to get to the our desired outcome or discrimination. Another way of looking at it is what we call as principal component analysis, PCA, where we look at the distribution of each feature and we try and see is there any cutoff we can take it, or threshold which we can use it to differentiate between 2 groups. That is another way of doing using features to extract.
So if I may simplify, the between groups, the shoe is an important classifier, but within group it is not. That's what I guess the feature extraction techniques start with. So moving on to the diagnostics part of neurootology, Colonel Sunil Goel, sir. This is a field which generates lots of mathematical data, graphs and tables and time series data. So how has AI techniques and how will they be useful in your discipline, sir?
I believe this would be the more easier part of AI to come into practical use. In fact, most of them are already being used in some way or the other. One of the commonest thing which is being used, where the AI is being used, is hearing aid technology, and it had been there for decades. Traditionally, hearing aid is mapped using the audiometry finding of individual, and there is no real-time changes which is possible to do with this earlier hearing aid technologies. But with AI technology, now there are hearing aids where the individual, whenever he adjusts his volume to the surrounding, Next time when he switches off and switches on his hearing aid, the AI model will be able to understand the individual needs and will adjust the volume settings automatically whenever he goes in such scenarios. Similarly, in fact, even the compressional technologies, audiograms which are used during hearing aid mapping, even those aspects can be taken care of with the hearing aids. Apart from this, there are, we have seen in the pre-lunch session, there was a video where it has shown that how in a noisy surrounding, the audibility can be improved. So this is already existing in hearing aid technologies. And this will help in overall speech understanding in a noisy surrounding.
I had a kind of a personal doubt in there, sir, when you sent me this slide, that when I say that the audio has been enhanced, even noise cancelling headphones are here. They're all over the market. So does that technique employ the same noise cancelling? Is just a Fourier transform, but and that is not AI. But is there any component to which can kind of select what it wants me to listen?
Yeah, it will be based on the individual perspective. Like noise cancellation would reduce noise uniformly across all situation, but maybe someone who is into music and that is a need of the individual. So AI will judge for an individual whether that is a noise for an individual or not, and will reduce based on the individual needs.
So it will learn over time.
Learn.
Okay.
So these are the other aspects where AI is already in use. Some of hearing aid part I've already covered. So next part is the vestibular disorders. I remember doing, I'm sure all the ENT specialists would agree that handling a patient with vertigo is one of the most difficult situation one comes across with. And the traditional model which we use as a clinician is a two-step model, wherein we take the clinical history, maybe some clinical examination, and we make a provisional diagnosis. Based on that provisional diagnosis, we go ahead with a further investigation if required, and then we come to a final diagnosis. This aspect has already been incorporated into AI technology, where this two-step model has been used, and prediction of vestibular disorders, which I remember that paper mentioned that around 15 to 16 diagnoses, it was able to distinguish with the accuracy of almost 90%. Apart from there are various other AI models, and which have equally good predictive value. But all this, next slide. But all this depends on how good the data is fed, the quality of the data, and both the quantity of the data. Also, we have predictive model to determine the severity of the sensory hearing loss based on this CNN and logistic regression models, where from the OE we have good accuracy of 80 to 90% in predicting the sensory hearing loss. And as I mentioned, again, that it depends on the quantity and the quality of the data. Similarly, other important aspect where we find difficult as clinician and also as audiologist is that identifying the ABR waves in a whether it is which one is a wave 1, 2, 3, 4, 5, and there is a lot of bias in this. With AI technology, identifying and removing this bias would be easier, and it is expected that these models can give accuracy of 90% in identifying the correct wave 5 beta waves and thereby predicting the pure tone thresholds. Similarly, it will be very helpful if this thing is further validated in identifying the correct ABR thresholds in newborn hearing screening.
I'll just take a minute to paraphrase the few terms that I've used. A logistic regression is a discrete version of a linear regression. Linear regression fits you a line into a scatter plot. A logistic regression is where you have only two outputs, a 0 and 1, red or black, green or blue. I mean, two classes, 3, 4, but discrete classes, not continuous like a scatter plot, but some will be here, some will be here. So if you want to fit a curve between these points, That is called a logistic regression model. Logistic regression model can be fit onto each other, one after the other, after the other, after the other, so that over time they become something like a neural network. Neural networks are just lots of logistic regression models after fit into each other. So moving on to the next.